Hello, my name is Herman. I'm the instructor for the Great Lakes Seminar's treatment of the lumbar complex. One of my favorite treatment techniques for the lumbar class is the sidelying technique to correct back dysfunction. What I love about it is once you get the patient set up for the treatment, you have options. You can do grade 3 or grade 4 mobilizations or a grade 5 manipulative technique if that's part of your practice act, or you can convert this into a simple muscle energy technique. So what I love about this technique is the versatility of it. Now the patient I'm working on here, we kind of did a quick assessment, so just so you understand what we're treating. The patient is limited in his ability to extend or arch his back up. His back is basically stuck in a flexed position and it's rotating off to the right side, so the patient's lying on their right side. And I'm going to target L4. So I'm going to come in off the iliac crest and I'm going to palpate our target L4. And I'm going to take up extension. I need to walk down to L5. And hang on to that for 1 second. I'm going to straighten out your legs a little bit and bend this top knee right there. All right, I'm going to come in to L5. And I'm going to extend the patient's legs until I feel motion at L5. Right there. Okay? And then I'm going to come back to L4. And I'm going to borrow the patient's downside arm and I'm going to rotate him until I feel motion at my target, which is L4 here. Right there. Okay? Then I'm going to have the patient grab their wrist and hang on to it. And then I'm going to thread the needle, basically bringing my arm between their torso and their arm, and put my forearm in the lateral 1/3 of the pectoral muscle. And then my other forearm is right in the back hip pocket area. And I'm going to take up rotational barriers and slack right to there. All right, so I've taken up all the range of motion and I can start my mobilizations from here. Either doing small grade 4s, larger grade 3 oscillations, or turn it into a muscle energy technique where I have the patient engage some of these small rotational muscles by pushing into my forearm with his shoulder. Exactly. And then holding it for a period of 6 to 10 seconds, and then I'll have him relax and take him a little bit further into his barriers. So again, what I love about the sidelying techniques is their versatility.